So now we're going to talk about how to apply a TENS machine to a patient and the dosages that you might want to use. Prior to applying the TENS machine, as with all other treatments, you need to have your patient's consent. You need to have checked that there's no contraindications. Your patient needs to be suitably undressed and comfortable to be able to tolerate the treatment. You also need to check their skin sensation, and the recommended test but prior to TENS is the blunt sharp. So I've got my little device here and I've got sharp at one end of the instrument, at blunt at the other. So I'm going to check with my patient, and I would have checked on a hand prior to going on a back so that she would feel what sharp and blunt are. So here we go. So
sharp, blunt, sharp, sharp, blunt.
Okay, so that's fine. She's passed that test. Now we're going to apply the TENS electrodes. So I've got self-adhesive kind of jelly electrodes, and the further apart you place the electrodes, the deeper the patient will feel the benefit of the treatment. So don't be afraid to put them right across the lumbar spine. So I just need to place those a little bit more securely. So one just to the left of the paravertebrals and one just to the right. I've got my TENS machine here, I've got my frequency, and I've got my pulse width. So I'm just using one channel. I switched my channel 1 on, and I have an option here. I can use high TENS dosage, which is a relatively high frequency but with a short duration of pulse, or I can use a low TENS dosage, which is a low frequency, about 2 to 5 hertz, and a longer pulse duration. With someone with chronic low back pain, I would probably use the low TENS setting because it's very like acupuncture for approximately 30 minutes. But the advantage of using the low TENS over high TENS is that it has good carryover of pain relief. So even after you switch the pain off after 30 minutes, you can carry on reaping the benefits of the relief. So we're going to set this at a low frequency of about 5 hertz, and I'm going to set my pulse length at about 200. And now, having set those, I'm going to gradually turn the machine up until my patient can feel a comfortable pins and needles. So patient, can you tell me when you can feel a comfortable sort of pins and needle buzzing kind of sensation?
Yep, now.
Okay, great. And you'd leave it there, and what happens is the patient accommodates to this sensation. So then you would be continually checking your patient through the treatment and possibly turning up the intensity a little bit as time goes on, because they get used to it and it feels like the intensity is dying down, but it isn't actually dying down, it's the patient getting used to it. So as I said, a treatment time could be about approximately 30 minutes, anything up to 30 minutes. There's also 2 other dosages that you can use if you need. There's the brief intense TENS, where there's a high pulse frequency but a longer pulse width mode at the patient's highest tolerance, and this tends to be for slightly shorter treatments, sort of 15, sometimes up to 30 minutes, but generally 15 minutes. And then on most TENS machines there is a burst mode as well, which can be used in any frequency, and this is sort of in high doses for a few seconds each burst. And that might be an appropriate mode to use when somebody's in labour to try and control the pain when they have the contractions. And as I've said, the most important thing is that you keep checking the patient throughout the treatment. An advantage of the TENS machine is that when you've got the patient competent and confident in using the machine, it is a machine that they can take home to use for pain relief, and they are also able to purchase them themselves from a local pharmacy store.